Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Kishore KV. He is a highly accomplished neurologist and a epidemiologist, epileptomologist, and currently he is practicing in Bengaluru. He is a brilliant academic career he has had with a gold medal and trained in Nimbans and has got MRCP from UK. He has got the postdoctoral fellowship from NIMHANS and he is very popular and has started his Spike and Wave social media also to bring awareness. Today, he is going to talk to us about the headache and that too the migraine. So, please tell us what is this migraine, sir?
Thank you, ma'am. So, migraine is the common type of headaches. It comes under the broad category of headache, and it is called as primary headache, basically. So, migraine is very common in our population. It is more common in women compared to men. So, that means we will know one person at least who is suffering
So
from
that means
migraine.
women have got more head than the men, you mean? Okay. Okay.
Yes. This is premonitory symptom. After that, aura will come. That is, aura is immediately before headache,
Okay.
and then
Okay.
it can be visual aura. It can be speech difficulty, memory issues, or some very rarely hand-leg paresthesias also we have seen, and
Oh,
then
I
followed
see.
by headache. Yes, which
Mm.
is lasting for hours and days, and
Mm.
then going to migraine hangover. That is post
Mm.
headache phase, which also lasts
Mm.
for few hours and few days. So that is what we all j- yes, four phase. Headache phase is what generally everybody knows, but there are
Mm.
other three phases also. In the
Mm.
headache phase, it is a prolonged headache. That is, it lasts for hours to days, and
Mm.
it is usually starts in one half of the head.
Mm.
That is
Mm.
either right side or left side. It can alternate,
Mm.
and then it also has a very severe, moderate to severe headache. That is
Mm.
unbearable headache. Few people
Mm.
will cry also because of the headache.
Okay.
Also, it has a throbbing quality. Quality of headache is also very
Mm.
important in migraine, and
Mm.
it has the sensitivity. Sensitivity means they can have nausea, vomiting, and also
Mm.
light sensitivity, sound sensitivity, smell
Mm.
sensitivity, and also allodynia. That is,
Mm.
if they touch their head or scalp, they get pain.
Mm.
So this is
Mm.
called as scalp sensitivity. So these are
Okay.
all the features of migraine. This is what we
Mm.
call it as migraine.
Okay. What are the trigger points? Because they're perfectly normal, they are very healthy looking, everything is fine, and suddenly something goes wrong and then they start getting this. So, what are those trigger points?
Yes. So majority of the headaches are triggered. So that means something is done by the patient to trigger
Mm.
the headache. So that
Mm-hmm.
means patient is giving invitation to the
Chance,
headache to come.
chance to the
Yes,
yes. Mm.
exactly. So it can be our day-to-day activities, that is going
Mm.
out in sun. If you are not able to have food on time, lack of
Mm.
sleep,
Mm.
stress, and in women before and during menstrual cycles,
Menstruation, yes.
and yes, yes, and also certain type of foods can trigger. Chocolate can
Mm.
trigger, wine can
Mm.
trigger, cheese can trigger, and many other things can trigger. Smell, very common trigger, and
Mm.
sunlight will
Smoking,
trigger. Travel can
smoking.
trigger.
Mm.
Smoking, and
Mm.
any other smoke also can trigger. So
Mm.
these are all the triggers of migraine generally.
Okay, okay, okay. I think all these things are routine for everyone in our life. And we must thank God that we don't have those as trigger points. Otherwise, everyone would have had the migraine. Now, how do you
Yes.
treat them? Because are there any investigations to do it, or how do you diagnose and how do you treat?
Yeah. So migraine is diagnosed based on the history, how the
Mm.
patient describes, and what is the type of headache they are
Mm.
suffering. And there is no one positive test report to tell it is migraine. It is basically the
Mm.
description, and
Mm.
with the basic examination, we come to the conclusion it is migraine. So this is
Mm.
the diagnosis part of the migraine. Second
Mm,
thing is, what is the treatment? So
mm,
because majority of the headaches are triggered, so that means,
mm,
so we will concentrate more on non-pharmacological the measures, that is to identify triggers, to we will
mm,
tell them to maintain headache diary, and
mm,
so that what is happening before headache, so that we can identify triggers over next few 2 3 months. When they document 8 to 10 headaches, we'll be
mm,
able to identify the pattern, and
mm,
we'll tell them to continue this avoidance, and if unavoidable, for example,
mm,
we have to go to sunlight, so to
mm,
wear goggles, to wear
mm,
sunscreen, and to wear
mm.
caps, and
And
to
earphones, so
umbrella.
that they now the noise also cannot trigger.
Yes,
Mm, mm,
exactly. And we'll tell them to become regular in sleep. Day-to-day
mm,
activities should be timed, and
mm,
have regular exercise. We
mm.
also recommend meditation and yoga if stress is
Yes,
taking over their life.
extremely important, because that will reduce their stress hormones and also release the endorphins and neuropeptides which are. And how to prevent? What do you tell them? How to be cautious about it and how to prevent it, sir? And what are these red flags
Yes.
in headache? And please tell about that red flags.
Yeah. So prevention is,
Mm,
as we discussed, to
mm,
identify the trigger and to remove it from our
mm,
day-to-day activity. If not
mm,
able to remove, and
mm,
to manage it better, and then to regularize our lifestyle, because tablets are temporary, lifestyle is
mm.
permanent. So
Okay.
permanent solution is to change in
Mm.
lifestyle.
Okay, so that means the disciplined life is very important. So regularly they
Exactly.
have to have a routine habit which they should not. So please tell us about the red flags.
Yes. So red flags in headache is, what type of headache you have to visit a hospital immediately, basically in
Hmm,
simple terms,
hmm,
because red is for danger. So
hmm,
extremes of age group in
hmm,
children or in
hmm,
elderly, or even in normal age group, if headache is very sudden, very
hmm,
severe, and this
hmm,
headaches was never before, and it is
hmm,
not coming down with medication, or
hmm,
any other neurological symptoms like blurred vision,
hmm.
difficulty in speaking,
Yes.
facial drooping, hand
Hmm,
leg paresthesias or weakness or numbness,
hmm, hmm,
unable to walk, falling. So if any such neurological symptoms are there, then
hmm.
also we call it as red flag. Most
Hmm.
importantly, if the headache starts and suddenly it is like worst headache in your life, so
Shooting,
that is
just
where
shooting,
we would.
like a bolt in the blue.
Yes.
Suddenly, like thunderstorm, it strikes. Yes.
Correct. Yes, and we call it as thunderclap headache. So if
Okay.
such
Okay.
symptoms are there, we would
Hmm.
recommend them to come to medical attention
Yeah,
immediately.
and there is any rupture of the berry aneurysms in the brain, and that can be detected. Otherwise, the regular headache doesn't
Yes.
not require any investigation. So, so
No, no,
ultimately,
no.
what exactly would like to tell our viewers? Me, I've never had headache in my life, so I'm always happy and smiling. So that's the way we should live. Yeah, please tell us, sir. What is your
Yeah,
final
one
advice?
important
Yes. Mhm.
message,
Mhm.
final advice is to identify the trigger and to avoid those triggers. So that will make your life much, much, much simpler, and to
Mhm.
regularize the lifestyle so that long term you don't have to be dependent on medications.
Yeah, thank you very much, Dr. Kishore, for explaining so nicely. And I'm sure all our viewers are benefited by the tips that you have given to them to avoid headache. So have the head, but not have the headache. So that's the motto. Thank you very much. Thank you.
Thank you. Thank you, ma'am.